So the thing about being the adult researcher is that you always go at the end of the day. And sometimes that's actually a great thing. If there have been a lot of talks that have been like, meh, so-so, then you can come in at the end and really wow everybody. But when you follow a lot of talks that have been really fantastic, it means you have a really tall order to fill. So I will do my best to rise to the occasion here. So back in about 2004, I started my postdoctoral work at the University of Wisconsin-Madison, as Paul mentioned, working with Dr. Marcia Malik on really one of the world's largest longitudinal studies of adolescents and adults on the autism spectrum. And when families came into the study, primarily families of adolescents, there was one question that came up over and over and over again. What's going to happen when my son or daughter leaves high school? What can we expect? And most importantly, what can we do to help make the transition process a little smoother? So back at that time, I went to the literature, to the research to say, what do we know from a research perspective about what to tell families, not only in terms of what to expect, but what will be helpful for them during this time. And the answer at that time was basically nothing. I mean, we really knew almost nothing, not only about what happened when people with autism left high school, but even more so, what can we do to be helpful? So that has really led me and a number of other people too on a course of study to really try to understand what does adulthood look like for people on the autism spectrum, and what can we do to try to improve adult outcomes. And studies across countries and across samples have really, I think, fairly well defined a number of different areas that adults on the autism spectrum tend to struggle or have challenges. We see struggles in employment, post-secondary education, social relationships, financial independence, physical health problems, and mental health problems are a subset. I think it's important to note that autism is just as diverse and heterogeneous in adulthood as it is in childhood, probably even more so. So we see some adults on the autism spectrum who struggle in none of these areas. We see some adults who struggle in all of these areas and every single possible configuration in between. But on average, these are all areas where we see a lot of struggle that are fairly well defined. And so then the next question, the follow-up question is, okay, what can we do about that? What do we know about ways to improve outcomes? And in that area, as researchers, we haven't done so well so far. We don't know much. And a lot of what we have learned from our studies are things that we really can't do very much about. So probably the most common predictor of independence in adulthood and employment is having a higher IQ. Okay, and that's nice to know. And that's good, but we can't really do anything about that. Family socioeconomic status comes up as well quite a bit in studies. And again, that's something that we can't really do very much about, although it is helpful information to have. So I'm going to talk a little bit about some of the changeable factors that we've learned about in our research that we think are related to outcomes. And I say we think that because the only way that we can really know is if we do trials or we do really rigorous research to say, if we change one of these factors specifically, do we see changes in outcomes? And most of that work hasn't been done. In fact, almost none of that work has been done. But from our correlational studies, I think we have some ideas and some hints. Also, the factors that I'm going to talk about are not an exhaustive list of the changeable factors. There are other things that I won't talk about today that if people have specific questions at the end, I'm happy to mention a few things more. But if I had 3 factors that I was going to put my money on, these are the things that I think if we change, it's going to improve outcomes. These are the ones that I would choose. So I did. I chose them. So the first is daily living skills. So daily living skills, and this has come up in a couple of the other talks, these are the set of skills that a person needs to kind of go about their daily life. These are things like hygiene, personal care, preparing food. It can be managing money, being able to manage transportation in some way, whether that's private or public. All these sets of skills that you all needed to wake up in the morning and get from your house to the meeting today, or to get to your jobs. Now, of the changeable factors that have been related to outcomes, this is probably the one that we have the best evidence for. A number of studies have found that individuals on the autism spectrum who have higher daily living skills are more likely to be working and they're more likely to be living independently in adulthood. Unfortunately, this is actually an area where people on the autism spectrum tend to particularly struggle. So I have up here a chart from one of my favorite studies to present by Summer Bishop here and Amy Duncan at Cincinnati Children's Hospital, where they took a sample of individuals on the autism spectrum and they binned them by their IQ scores. So this is full-scale IQ. They had individuals who had IQs from 85 to 99, 100 to 114, and IQs of greater than 114. And they looked to see what was the average daily living skills score in each of these different groups. Now what we see in almost every population is that IQ and daily living skills track together. So as IQ goes up, you would expect daily living skills to go up. And in these particular measures, we have means of 100, so the same mean and the same sort of scale for both measures. So what you would expect to see is that for a group that has a mean IQ of 92, you would expect to see a mean daily living skill score of around 92, right? If you have a mean IQ score in your group of 126, you would expect to see a mean daily living skills score of around 126, give or take. But that's not what we see here, right? We see that as IQ is going up, daily living skills scores are not really. And we see about a 14-point deficit for those in the lower IQ range, and that goes up to a 43-point deficit in the higher IQ range. So daily living skills we can do something about. I'll talk a little bit more in a moment about what I think we can do about it. And this is an area that I think if we can do a better job of working on this among people on the autism spectrum, we may actually be able to move the needle a little bit in terms of outcomes. Okay, number 2, co-occurring mental health problems. So studies, almost every study that looks at mental health problems, and mostly anxiety and depression among people on the autism spectrum, find much higher rates than what we would expect in the general population. This is just an example of some work I did with Dr. Kate Gotham at Vanderbilt. What we found, and this was a sample of young adults who were just getting ready to leave high school. And what we found was that about 25% of our sample had evidence of really clinically impairing significant mood symptoms. 25% had clinically impairing really significant anxiety symptoms, and there was really little overlap between those groups. Only one person overlapped in the sample, meaning that almost half of the sample had really significant mood problems or anxiety problems, and only about a third had little to no evidence of these behaviors and symptoms. There actually has been surprisingly little research that links mood and anxiety problems to outcomes in adulthood. It's a real, I think, black box, a missing piece of what we know about autism and outcomes in adulthood. But there have been a few studies that have sort of danced around this a little bit and find that sort of behavior problems and symptom type measures are related to difficulties maintaining employment and independence. And there are certainly ample evidence for this relationship in other populations. If somebody has mental health problems, it really leads to a whole host of difficulties in adulthood. There's no reason to think that this would not be the same in autism, even though our research isn't really there for that. So again, even though the research is a little bit weaker, although there is some, this would be the second area that I would think if we can work on ameliorating mental health problems among adults on the autism spectrum, I think we could really see an improvement in outcomes. And number 3, better access to services. Now, I would say probably the best established finding in adult autism research is that adults are not getting the services that they need to reach their maximum potential. We find this across countries. We find this in basically every single sample that looks at it. If you go to IMFAR, to the International Autism Meeting, you're going to see probably 20 posters that are all going to tell you that adults are not getting the services that they need. This is something that we know. This is something that happens pretty much no matter where you are, although the degree of the extent to which people aren't getting the services that they need can differ. And there are 2 contributing factors, the way that I see it, to this issue. The first is that the adult service system is underfunded. There aren't enough services out there to meet the needs of adults on the autism spectrum. So that's one issue. That may be hard for us to do something about, although we can certainly all advocate, and I know many of you in this room do, for more funding for adult services. But the second is that even when the adult services are there, the adult service system is so complex and so complicated that it is really difficult for families to access what is there. So we see services related to housing and financial support and post-secondary education, conservatorship, employment, special needs trust, medical services, secondary education if someone's still in school. Many of these services are administered by different agencies and organizations that don't talk to each other, but the services depend on each other. You have to get this to get this. If you get too much of this, then you can't get this, or you get less of this. And it's really complicated, and it makes it really hard for families to navigate and access even the services that are there. So this is kind of the chunk of this issue that we've taken a stab at in our research. So we developed a 12-week program that trains parents about the adult service system and how to advocate for services on behalf of their son or daughter. Each week focuses on a different aspect of the adult service system, but with a real focus on how they fit together, and with a real focus on really the nuts and bolts practical information about, for example, how do you get SSI? This is what it says on the application, but this is what you have to write to get it. This information that can be really hard for families to get, but is critical to service access. So we developed the program and we've tested it. And our initial findings are really promising. It's with a small sample, so take that with a grain of salt. But what we found was that for the families that took the program, 6 months after taking the program, they were getting about 1.5 more services than they had been getting at baseline. Our control group, who hadn't yet taken the program, was getting about 0.5 more services. And thinking about this a different way, just over 60% of our intervention group increased in the number of services they were getting at follow-up, compared to about 1/3 of our control group. So this seems promising, right? Now, the next thing that we looked at was, did participating in the program actually lead to higher rates of employment and post-secondary education participation? And this finding we have to really, really take with a grain of salt, because the way that we recruited the sample, many of them were still in high school at the follow-up. So we have a smaller subsample of our pretty small study to begin with. So just to keep that in mind. But what we found was that of the families who took the program, at the 6-month follow-up, all of their sons and daughters were working in the community or were in college, compared to 50% in our control group. So again, we have to take this with a grain of salt. We really, really need to test this out in a larger sample to see if these findings stand. But I think this at least makes us feel hopeful that getting families information about adult services in a digestible way might actually be enough to move the needle at least a little bit in terms of outcomes and in terms of service access. Okay, and in my time left. So what can we do? What can we do to improve outcomes? The first thing is, I think we as professionals in particular can do a much better job focusing on and teaching daily living skills. So if a student with autism is mainstreamed and spending their time in general education settings, they are unlikely to get any instruction in daily living skills at all. And if they go to college, they're still not going to get any instruction in daily living skills unless they are fortunate enough to go to a great program that has autism supports. So this is something that I think we can do a lot better on, and I really do think it's going to matter a lot. And I know that there are researchers who are beginning to think about testing daily living skills interventions, which will actually give us much better evidence for this issue here. But I think it's going to help. We, of course, can do a better job addressing mental health problems, and there are some real issues here. We have a lack of psychiatrists who are able to treat adults on the autism spectrum, and that can make things difficult. We also don't have the range of treatment options that we need to really be able to effectively do this. We have drugs that we can use. Some behavioral therapies are starting to be tested with some people. But again, this is something that we need to do a better job at. And I'm actually really hopeful that this is going to change a lot over the next 5 to 10 years. There's a lot of energy, I would say nationally, and in the research community, and I think in advocacy organizations, around thinking about mental health issues among adults with autism. And I'm really hopeful that that's going to lead to more treatment options and hopefully more providers in this area. And finally, we can increase access to services. And of course, one way to do that is for all of us to continue to advocate fiercely for more money for the adult service system. But even in the absence of that, I think we can do a better job working with families to increase their access to the services that are there. And integration is going to be key. Thinking about integration from school-based to adult services, starting early, having adult service providers coming into schools to talk with families about what supports might be available to their son or daughter after they transition. I think some states probably already do this fairly well. In Tennessee, we don't. And also people who can work with families to help integrate across services. Given the complexities of the adult service system as it stands, if families have people who can work with them, case managers type, to say, okay, what are your son and daughter's hopes and dreams? Here are the services to pursue, and here's how we can think about doing that. I think that in the absence of changing the service system, I think that can be a really helpful way to improve outcomes. And there we are. So thank you so much for your attention.